woman comes to the doctor because of her hair loss, the physician must consider all sorts of causes. Possible things include genetics, hormones, diseases, chemical, trauma. Other possible causes include stress, nutrition, and medications. The average human head has about 100,000 hair follicles, and yet we lose 100 of those every day. You would think in 1,000 days we'd have lost them all. New ones grow to replace the old ones. As we age, the new follicles get weaker. The new hair that's grown is thinner, more fragile. The most common cause of hair loss is hormonal. As women age, as they go into menopause, the loss of estrogen causes their hair follicles to die. Other hormonal changes can cause things such as pregnancy, childbirth, and birth control pills. But almost all women, at least over half of women by the time they're 80, will show this hair loss pattern. It's a receding along the part lines. There are many diseases that can cause hair loss. Endocrine problems such as thyroid disease, hormonal such as polycystic ovarian disease will cause it, anemia. There's so many different possibilities. And also there's a very weird one called alopecia areata. In alopecia areata, one gets these very strange bald spots on the scalp. It's usually caused by stress. I had it when I was a medical student. Fortunately, this hair will grow back on its own. Then there are, of course, local skin conditions. Psoriasis and seborrhea in the scalp will cause hair loss as well. There are many medications that can cause hair loss. Certainly those for cancer, hypertension, and heart disease are common. Also depression, arthritis, and gout, all those may cause hair loss. Check the side effects of your medications if you're suffering from this issue. Heavy metal poisoning is a very rare condition, but sometimes people exposed to mercury or thallium will have hair loss. And then there are certain diseases which can cause hair loss as well. Any disease with a high fever may stress the body, and certain types of diseases like syphilis is known to cause hair loss as well. Physical trauma will cause hair loss. For example, people who stress their hair in these tight corn rolls, that will cause that. And then chemical exposures at the hairdresser, certain hair dyes, or chemicals used in permanents can also cause certain hair losses as well. Sometimes stress alone, like in a severe trauma or end up in the emergency room, will cause subsequent hair loss. Or some people are so stressed they end up pulling out their hair. So that will cause hair loss as well. Your hair is the fastest growing cells in your body, and so it needs good nutrition to keep going. Vitamin A is necessary to make the sebum that keeps the scalp moist and the hair healthy. Vitamin C is needed to produce a collagen. Vitamin D and certain B vitamins such as biotin are necessary for your hair growth, and even minor elements such as vitamin E and zinc and iron are necessary for a healthy head. So be sure you keep a good nutrition balance to keep your hair healthy. To maintain that healthy crown, keep your hair gentle with soft shampoos, gentle brushing, and try to avoid stress, have good nutrition, and see your doctor if you're having unusual hair loss. This has been Dr. Philip Levin with a short medical minute.